So we're going to talk about chemotherapy-induced peripheral neuropathy. So tonight, what I want you to get out of it is just to understand that relationship between some of the common chemotherapies and how we develop neuropathy symptoms, and understand the how and why of why we get the neuropathy symptoms we do, some strategies to improve symptoms and reduce the risk of injury when you have neuropathy, and then the role of PT in neuropathy management. So what we could help you with if you needed it. So what is CIPN? So if you're on here, you probably already know these things and you know the symptoms, but as a review, so it's really the second most common side effect that people will experience with neurotoxic chemotherapies, and it damages peripheral nerves. So those nerves that are outside the brain and the spinal cord. And the incidence ranges from 30 to 68% within 30 days of chemotherapy completion for people that are on these specifically neurotoxic chemotherapies. So just a review of our anatomy for why neuropathy occurs where it does. So you have your central nervous system, which is really just your brain and your spinal cord here. But then your peripheral nervous system is all the nerves that are traveling out distally, all the way to your fingertips and all the way to your toes. And those are the nerves that are typically affected by neuropathy symptoms. So when we think about what functions those nerves have, they have motor functions. So that's giving you the outgoing message. And it goes to your skeletal muscles, your internal organs. So like your GI muscles, your urinary muscles. You have sensory, which gives you that incoming message. So whether it's pain, it's temperature, it's touch, it's deep pressure, all of that. And then you have your autonomic system, which is the nerves that control our fight or flight. So it controls blood pressure, it controls our GI, how things move along. So constipation, things like that, urinary urgency. And then we have a difference between what we call small fibers, which are thin, and large fibers, which are thick. So I'm going over this because some chemotherapies will directly affect our small, thin fibers because they don't have this insulation. And when we have the chemotherapies that target those, typically we see issues with pain, touch, and temperature, and some autonomic issues. And in the large fibers, where they have those myelin sheaths, we see issues with proprioception, which is kind of understanding where our body is moving in space. So balance is typically an issue here. And then also with our muscles. So these large fibers help to make our muscles move. So when those fibers are attacked by the chemotherapy, oftentimes we'll have issues with like pinch and grip strength for things. So opening jars can sometimes be a problem, or lifting up our feet. So some people will talk about like they feel like they shuffle their feet or their feet get really tired on uneven surfaces. So the symptoms that individuals experience are really because of the way the connection of those nerves is working. So we talk about it in 3 different ways. So it's kind of like this numbness that people experience is basically the loss of the signal. So if we're talking about sensation, and when you touch something and that signal goes back through the peripheral nervous system to your brain, that signal is no longer going back where we want it to go. Or you can have an inappropriate signal, which is like that tingling feeling that you get. And that's really like you think about like static on a phone line. So there's nothing really going on right now, but you hear static or you feel that tingling. And then there's errors that distort the message. So thinking about pain when you shouldn't have pain. So a lot of patients will tell me when they pull the sheets up at night, it can be problematic because they feel pain rather than they feel what the sheets should feel like. So it feels like sandpaper or it feels like glass on their feet. So some common causes when we get into the different types, it's because of where they're attacking the nerves. So this is just a nice graphic of how different chemotherapies can affect nerves differently, which is why if you're on a cocktail of different chemotherapies, you get different symptoms from that. And even though another person may have chemotherapy as well and have neuropathy, their symptoms might be completely different than your symptoms of neuropathy. So some common chemos that are often implicated in chemotherapy-induced peripheral neuropathy. So you have platinum compounds. So your cisplatin, carboplatin, oxaliplatin, your vincristine. So that's a vinca alkaloid. And then Taxol and Taxotere are the common ones that we hear of that patients often have a lot of symptoms with, as well as thalidomide, which is an immune modulator. So when doctors are listening to your symptoms and they're trying to figure out, is it chemotherapy-induced peripheral neuropathy, usually they're talking about, or they're listening to symptoms of stocking glove. And what I mean by that is the symptoms start at the fingertips or the toes, and they spread up the hand like a glove, or they spread up the foot like a sock. And that's what they typically, if it's bilateral, if it's both arms or both legs, that's when they're going to say, okay, this is as a result of your treatments. Typically, patients will have more sensory than motor symptoms, and obviously the timing will be after the start of chemotherapy. So some symptoms to look out for that we typically will treat. So you have your sensory, your motor, and your autonomic. Those sensory symptoms we'll hear often are the pins and needles, or people will report to us that their socks feel bunched up under their feet when they're walking, or there's pain and hypersensitivity, like I mentioned, the sheets, sensitivity to cold, and then difficulty with fine motor tasks. So if you think about when you can't feel things, oftentimes that comes with like trying to turn your keys, trying to write, all of these little things can really add up when you can't necessarily feel, or you can't generate that strength in the tips of your fingers. And then motor symptoms, these are things that we don't often think about because our feet or our fingers hurt so much, or they're bothering us so much because they're numb or they're tingling, is things that we take for granted. So buttoning sometimes can be difficult, or when you're walking, your loved one might say, I can hear you coming now. I didn't used to be able to hear you coming, but when you're walking, your feet get more tired, so you're more likely to slap your foot or not clear it as well, or you might notice that you're lifting your hips up a little bit more, lifting your legs up a little more when you're walking on uneven surfaces because of that distal weakness that people will experience. And then we also talk about furniture walking. So oftentimes when we call it proprioception, so that's the joint's ability to recognize where your foot is in space or where your arm is in space as you're moving. When you have neuropathy, that proprioception is reduced. So oftentimes you might feel a little more unsteady. So you might notice that you touch things as you're walking. So you might touch the counter as you go somewhere. You might touch the wall when you're going up the steps. And that can be a result of that reduced proprioception. And then there's autonomic symptoms. So these are things that we don't often think of, or we might attribute to other things like dehydration or feeling nauseous with chemotherapy, but sometimes it can be linked to the neuropathy. So orthostasis, or that feeling of when you get up quickly, your blood pressure drops or you feel dizzy, that can be related to neuropathy as well, because it relates to how the blood vessels constrict to get that blood flow back to your head. You can also see abnormal responses to activity. So when you're exercising, you might feel more fatigued because your heart rate's not responding as well as it could because of neuropathy. And then urinary dysfunction and constipation can come with this as well. So in terms of management, you probably all know these medical management strategies, but really there's no gold standard as to what will help with neuropathy, which is very trying. But typically individuals will get prescribed Lyrica or Neurontin or gabapentin or duloxetine. And duloxetine, I think, is really the gold standard in terms of pain management, but there's nothing out right now that's going to reverse the damage to the nerves. So the nerves will hopefully heal and reinnervate the way that they should. However, to stop it in its tracks, there's really no specific medication at the moment. There's also alternative therapies that individuals can try. So photobiomodulation, which is basically laser therapy. There's some good studies out there showing that there's some benefit. And then guided imagery, meditation, and relaxation has been shown to help to reduce symptoms of chemotherapy-induced peripheral neuropathy, specifically the pain symptoms. And then electrical stim, so TENS machines, can often help with some of those symptoms. And then physical therapy. So in physical therapy, what we do is we look and assess and treat to promote the balance aspect, any strength, and then we talk about safety. And then we'll educate individuals on whether they need adaptive equipment, footwear, orthotics, and then talk about exercising. And we'll talk about why we talk about that. And then sensory re-education and desensitization techniques. So what you can do to kind of address the symptoms at home. So we're going to talk about all those pieces that I typically educate people on when they come in to see me. So the biggest thing that I talk to them about is falls. So individuals that have had more than one neurotoxic drug in their chemo cocktail that has caused neuropathy symptoms are more likely to fall. And that impact can last well beyond when you've had chemotherapy. So often we will do an assessment on physical therapy of balance and fall risk for individuals. And we'll talk to them about home setup and things like that because of that increased risk. So here's just a list of some of the things we go over. So I mentioned the furniture walking. So if you're finding when you're going throughout your house and you're kind of touching things, that tells you that you're using different resources to keep yourself balanced and you're creating new strategies because your typical strategies that your nervous system would use aren't necessarily available to you at the moment. We talked about the scuffing the feet or the feet feeling like they're slapping as you're walking. That can be one as well, because then you're more likely to trip. If you find yourself looking down while you're walking more than you used to, that can indicate also that there's that sensory issue. So you have 3 different systems that help to keep you balanced. You have your inner ear, you have your vision, and then you also have your sensation. So if you're staring at the ground, that tells you that your sensation might not be as helpful. So you're using your vision, you're relying on that to keep you balanced. Dizziness upon standing, and then postural changes, decreased walking speed, and then multiple attempts to stand up from a chair. We always talk about as well, because oftentimes when you go through chemotherapy, you're not just getting the neurotoxic drug, but you might be getting a steroid with it, or you might be getting other things that make your proximal muscles weak. So your core, your hips, and things like that, which make it harder to move in general and make it you're more at risk for falling. So we'll ask individuals these questions that are from the Centers for Disease Control. So it's just 3 questions. Have you fallen in the past year? Do you feel unsteady, or do you worry about falling? And if they answer yes to any of those, then we talk more about like, what can we do balance-wise, strength-wise to help them with that. And also, if you wanted to go on the website, if you have any loved ones that you're worried about as well, they have a really good fall risk questionnaire at the CDC. If you just type in "stay independent" in the Google, and it will bring you to this sheet, and it basically goes through different risk factors for falling and why it matters. And that can be helpful just because then you can see exactly why they're asking the questions. But if you answer yes to 4 or more of those questions, it indicates that you're more at risk of falling. The other piece we'll do, I won't make you guys all do this on screen, but we typically will have people do maybe a 5-time sit to stand. So we time them to see how fast they can get up and down without holding on. We have them do a single leg stance, so standing on one leg, and then one where they're doing a tandem stance, so one foot in front of the other. So the 5-time sit to stand, if you're not able to do it in 12 seconds or less, that tells us that you might have some strength deficits or some weakness that could lead to falls. And then your single leg balance or your tandem, we typically look for at least over 10 seconds to be able to do that. And if you're not able to do that, that tells us the balance may be off as a result of sensory issues, so that sensation. So environmental factors I'll typically talk about: throw rugs and clutter. So making sure your throw rugs either have something underneath of them so they can't move at all, or getting them up if you're feeling like the neuropathy is limiting your walking abilities. Lighting, again, when we go back to those 3 systems that help you to balance, if your lighting is dim, like on the stairs or at night, if your lamp is further away from the bed or you have to get up and use the bathroom, if you have sensation issues because of neuropathy and your lighting is limited, now you're down to your vestibular system because you don't have sensory to help you, and then you don't have vision. So you really want to make sure that you have adequate lighting. The bathroom setup is important. Talked about the stairs, and then well-meaning friends. So if you're feeling off balance, I know everyone always walks into the doctor's appointments and your friend or your loved one is holding on to your arm because they're worried about you falling. And what I always tell people is, if you are holding on to someone's arm, they have less ability to catch themselves. So if you feel unbalanced, you should hold on to the person that you're walking with rather than them holding on to you, so that you have all of your reactive responses. Some things that I recommend: to individuals. So if they are having difficulty, grab bars can be helpful. Different things for at the tub, putting non-slip on your stairs, like those wood stairs in the picture before, or non-slip in the tub. And then the two pieces specifically for neuropathy when you have issues with your hands. One, I love these shoelaces from Amazon. I'm not affiliated whatsoever. I'll say that. But these shoelaces are curly no ties. So if you're having neuropathy symptoms and it's hard to tie things, or it's hard to really get a good grip on your shoelaces, these basically go in and then you just pull them, they tighten, and you let go. So you don't have to have great dexterity to maintain them, and they're $6. The other piece is reachers. So oftentimes when we have neuropathy, that orthostasis can come into play, and you put your head down and you go to stand up. Or if you're currently going through chemo or treatment and you feel nauseous or you're dehydrated and you go to put your head down to pick something up, you feel off balance, these reachers can be really helpful as well, that are right here in this corner. And then in terms of management of the symptoms, so we talk to individuals about a sensory diet. And what I mean by that is you're giving your nerves sensory input at regular intervals throughout the day. So you're feeding the nerves sensory input to help them to learn what they need to learn about the environment. So if you think about chemotherapy-induced neuropathy, is the chemo basically damages the nerves to the point where the signals aren't appropriate. And we need to retrain those signals to be as appropriate as possible and for our brain to interpret things appropriately. So if you have numbness, you want it to get back more towards, sometimes it'll go from numb to tingling and then back to normal. Or if you have tingling, we want that to interpret correctly as whatever you are touching. So oftentimes I'll tell patients, find something that's just slightly irritating. And what I want you to do is I want you to rub that on your fingers, and then I want you to rub it somewhere where the sensation feels normal. So maybe further up the arm, and keep going back and forth and telling your brain, okay, this is normal. This is a blanket or a cloth or whatever it is, and this is normal, and touch it, and just do it 3 times a day for 5 minutes. And eventually that sensation that you're feeling of that sheet or that cloth that feels hypersensitive or tingly will start to feel more like normal. And when that does, then you're going to go find something else that irritates them. So for individuals that have hyposensitivity, meaning you have numbness, you don't feel as much when you have shoes on or when you're walking around, we talk about the fact that when you have hyposensitivity, there's a general lack of signal going back to your brain about what's going on in your fingers and your feet, in the joints at those areas. So it can be difficult to perform your daily activities, whether it's writing, whether it's putting on makeup or doing your hair or buttoning, things like that. So practicing tasks that can be difficult can be helpful. And then again, just doing it in small little bits. So oftentimes people will say they have difficulty picking things up, or they have difficulty differentiating. So whether it's like a paper clip or a marble or a dime or a quarter, and I'll tell them to get a big bag of rice, of dried rice, obviously, and put those pieces in there, and without looking, reach in there and try to find it. So you're training your sensory system again, even with all those other stimuli, those little pieces of rice around it, to try to find the right thing. With hypersensitivity, it's very similar. So someone that might have tingling or it's painful when you touch things, we're basically trying to teach those nerves what things should feel appropriate. So we'll start off again with like cloth that might feel slightly irritating, and then we build up from there to things that might be more irritating. Oftentimes we'll talk about doing vibration. So if you have like a back massager or something like that, you can put it on your toes. On Amazon, they have little vibration tools that have different tips to them that you can use like just on your fingertips or just on your toes, and different shapes, so that you can kind of run it along the nail bed if that's the most irritating spot. And I can put a link later on to that as well. That can be helpful because it kind of wakes up those nerves, and then it allows you to then do other tasks. If anyone remembers back in the 90s, everyone that played soccer liked to wear those horrible Adidas sandals that had the little spiky things in underneath of them, and you'd walk around with them. I thought I was cool wearing them, and they were the most horrible things to put on after a soccer game. They hurt so bad. But so in therapy, we have something that has little spiky things like that. I don't make people stand on it, but what we do is we rub our feet back and forth with that, and we might time ourselves doing it for 2 or 3 minutes. And what it's doing is it's increasing that irritation stimulus, but then it calms the nerves down afterwards. So if you have tingling or hypersensitivity and you do that, afterwards it should feel better. And then we're able to do massage techniques and all of those other pieces. And with that, I should say, if you can suck one of your loved ones in and tell them that the doctor recommended that you get a foot massage or a hand massage, that is very helpful. So deep pressure often will override the pain sensation. So if your hands hurt, and they feel like that hypersensitivity where they're tingling and they just won't turn off, just doing a deep pressure along your hands and along your fingertips and kind of holding that before you do any like light techniques where you're rubbing different textures can also be really helpful. And then the exercise pieces. So research is now showing that exercise can have a protective effect when you start chemotherapy to kind of blunt how much neuropathy you might get. And then also it helps assist in nerve repair following. And really, they look at structured exercise programs the most in terms of like they'll have them do aerobic exercise, some strengthening, and some balance activities. And the reason they think the exercise is helping is one, because it counteracts that muscle mass that can be lost with neuropathy, specifically like at your feet and your toes and your fingers. And then it's associated with muscle reinnervation and peripheral nerve growth, because when you exercise, you get all of these anti-inflammatory molecules circulating around in the bloodstream that can go out and help to heal the nerves. And this is just here because we know that even if you're coming on here because you have neuropathy, it's unlikely that that was your only symptom with treatment, because it's also unlikely that you only had one treatment, right? So everyone goes through their own cancer journey and their own treatment journey, and the effects can be cumulative and you can have multiple side effects, not just one. So exercise in some capacity can help with many of the side effects, which is why in PT we talk about exercise, but then we kind of strategize what's beneficial to you based on the side effects you have, and then based on the treatments that you've gone through. So for individuals that are going through chemotherapy, when you're exercising, they talk about during and 3 to 6 months after treatment, trying to maintain what we call a Borg scale of 11 to 12. So you're working fairly light. So it requires some effort, but not enough to speed your breathing. And then once you get past that 3 to 6 month window, then you might be working in the somewhat hard range. And I always say, like, this is a hard thing to understand. So this was created for cardiac rehabilitation for individuals that are on medicines that blunt their heart rate response. And so they found that a 6, where you say you're not really exerting yourself, correlates to like 60 beats per minute. So if you add a 0 to all these numbers, it correlates to a certain heart rate, which tells you how high intensity you're working. But you can also use what we call the talk test. So if you are exercising, regardless of what it is, whether it's a brisk walk, you're biking, you're gardening, and you can talk, but you feel like you would have a hard time singing, that's considered moderate exercise. And that can be beneficial to help with some of the side effects of treatment. When we talk about exercise, I always give the caveat to my patients of, before you start, think about what activities you want to do and what footwear you have, especially if you have neuropathy. So I talk about footwear in terms of, if you don't have the appropriate shoes and you go out and buy new sneakers to wear, put them on for 30 minutes the first time and then take them off and check your skin and make sure you don't have any irritation, and then build up to an hour the next day and then maybe 2 hours the following day. Don't just say, oh, they said that exercise is good, I'm going to go for walks and I got these new sneakers, and you put them on and you go, because sometimes you'll get skin breakdown with that and you might not feel it as much if you have neuropathy. During exercise, you always want to start with low intensity. They've found that chemotherapy is actually protective against some of the cardiotoxicity you see with like the adriamycins and the Herceptin treatments. So it is very beneficial, but you also have to think about what exercises you're doing and the intensity that you're doing them at, because sometimes holding weights might not be the best thing when you have neuropathy. Also with that, you want to consider going slowly and building up very slowly, because your heart rate's going to need a chance to catch up, as well as that orthostasis that you might experience because of neuropathy. And then last but not least, I'll often talk about safety measures. So in the house, if you have neuropathy, thinking about using cold water first and then moving to warm water, because it wakes up those fingers so that you can actually feel that sensation, because oftentimes you can't necessarily notice when you're going into hot water. Setting the water heater a little bit lower, between 105 and 120. Obviously using the well-padded pot holders, wear gloves when you're doing yard work and household repairs. If you get lightheaded, always pump your ankles before you stand up. And then you can also consider compression socks. So you can talk to your physicians about this, but sometimes a low grade compression sock, so they talk about like millimeters of mercury, like a 15 millimeter of mercury compression sock, can kind of help aid that feeling of feeling fatigued, or feeling like when you stand up, you feel lightheaded, or when you're walking for a period of time, you feel lightheaded, because it helps to kind of give extra pressure to your calves to help with blood flow return. Footwear, always wearing footwear inside and outside the home with protective soles, and then skin checks. So someone with neuropathy that has numbness, I always tell them I want them to get like a handheld compact mirror, or like the dollar store mirror, and every night check your feet and check your hands for cuts and scrapes, because when you're going through treatment, oftentimes you're more likely to get an infection. And if you get a cut or scrape in your foot, you might not necessarily know it until it already has a problem. And here's always my caveat. So if based on what I'm telling you, you feel like, oh, I do have some balance issues, or I do want to talk to someone about it, always talk with your physician as well. But if you are looking for a therapist, some questions I always want people to ask is, are they familiar with the treatments that you're on? So whether it's the treatments you've had, the treatments you're on now, or if you have upcoming treatments, do they know what those are and the impact that it has on your muscles, the impact it has on your skeleton and your sensation? And then how do they incorporate what your treatments are into their plan of care? So if you have radiation coming up, how are they going to account for that in your physical therapy treatment? They should be able to give you a list of activities you can do at home. And then they should also be able to recommend some community programs for you to participate in following therapy. So if you decide to go to a therapist close to your home, always kind of have that checklist ready to ask them those questions, so that you know they're the best person to be treating you.